Hello, colleagues. Good afternoon. And thank you for just a warm welcome to all of you to today's consultations on practical actions for locally led cluster transition and deactivation. We are 1 minute past the hour, and I think we'll start with whoever has joined us as we wait for the other colleagues to join us. So a very warm welcome from all of us at the GNC, and thank you for taking time out of your busy schedules to join us this afternoon. My name is 𝗘𝗿𝗶𝘀𝗵, and I work at the GNC as the localization help desk. I'll be your facilitator today. So before we start, just a few housekeeping announcements. We have French translation available, and this can be accessed by clicking the globe icon on the bottom of your screen. Next slide, please. To save on bandwidth, we are also asking that you keep your cameras and mics off unless you are speaking. Please introduce yourself in the chat and let us know which organization you work with and what country you're based in. We also encourage you to put your questions in the Q&A box. It's right next to the globe icon at the bottom of your screen. There'll be opportunity to post your questions directly to the speakers during the Q&A session. To do so, we ask you to raise your hands and we will unmute you. You can also feel free to put any general questions or reflections you have on the chat. And last but not least, this webinar will be recorded, and the recording and all the PowerPoint slides and other resources will also be shared on the GNC website. Next slide, please. I will now hand over to the GNC's coordinator, 𝗙𝗿𝗶𝘀𝗵, for his official opening remarks. Over to you, Stefano.
Thank you very much, 𝗘𝗿𝗶𝘀𝗵. Can you hear me?
Yes, we can hear you. Please go ahead, Stefano.
Okay, good morning or afternoon to everyone. Thank you very much for attending this call. It's a great opportunity to meet many of you. I'm 𝗙𝗿𝗶𝘀𝗵. I'm the Global Nutrition Cluster Coordinator, and I'm based in Geneva. Now, just as an introduction, you all know that the humanitarian system has changed significantly over the last year, and the impact of the funding cuts on people affected by crisis and the organizations that they serve has been significant. However,
you're muted, Stefano. Probably automatic. Yes.
Okay, thank you. Okay, so let me start again. Did you hear anything I said, or?
Yes, up to the change of environment.
Okay, thank you. So while there are reducing funds, there are also increased needs. This is due to climate disasters, protracted conflict, and sudden onset of public health crisis. There is a wide recognition that with less resources and continued emergency, locally led actions needs to be at the front and center of emergency response. The Humanitarian Reset, which was launched last March by the Emergency Relief Coordinator in OCHA, as a reform process for the humanitarian sector, places a lot of importance on localization, and this is really the first and most important principle of the whole reset. We can recognize this, and we have been recognizing this at the Global Nutrition Cluster already for some years. And many of you who have been working to promote localization in nutrition and emergency response will know that the Nutrition Cluster has been strongly advocating for this. And with the exception of a few countries where local and national actors, in particular national authorities, are not able to uphold humanitarian principles, in all the other countries, we work primarily in support of national efforts and their leadership. And so we can say that 100% of countries where we can support local and national authorities in their leadership, we do so. The Global Nutrition Cluster Anti-Racism and Localization Working Group, which was established in 2020, is very active and has great local and national actors representation. The localization roadmap, which we developed almost 2 years ago now in 2024, is considered a very valuable reference for advancing the localization agenda. In addition to providing critical and context-specific technical and institutional capacity building to local and national actors, we recognize the importance of amplifying their voices and visibility. The GNC has recently established a directory of local and national actors on our website, alongside its existing GNC localization dashboard. As part of the GNC efforts to advance localization, we officially launched the new GNC strategy last week. This new strategy acknowledges the importance of centering local and national actors as leaders in nutrition and emergency responses, and localization is strongly embedded across its 3 strategic objectives. So we've organized today's consultation on the spirit of this new GNC strategy, and we see this as an excellent opportunity to ensure that the perspectives and priorities of local and national actors inform the ongoing work on the humanitarian reset, the cluster simplification, and transition processes. We look forward to hearing your inputs and to exchanging across different countries and contexts, and thank you for your attendance. Back to you.
Thank you. Thank you so much, Stefano, and welcome to all the colleagues who are still joining. Please feel free to introduce yourselves on the chat. Before I introduce our speakers, I would like to quickly build on what Stefano has highlighted regarding the GNC's efforts to advance localization, just to share some information about the kind of support we have available for to local and national actors. Next slide, please. So at the GNC, we offer 4 types of technical and operational support to local and national actors and other nutrition and emergencies organizations who request the GNC services. Firstly, we offer what we refer to as quick remote support, which is basically our program team colleagues and other advisors providing quick guidance and support on a remote basis. So this might include technical advice on nutrition and information management. It might include nutrition cluster coordination support. And specifically for local and national actors, this support could also include sharing of tools and resources and facilitating contact and partnership with other organizations. Secondly, we also offer what we refer to as in-depth support, which is a more detailed technical support that takes place between 6 to 8 weeks. And this can either be done remotely or in country. And particularly for local and national actors, this could include remote coaching over a specific period of time. It could also include virtual remote thematic trainings, as well as in-country training, coaching, and implementation support. Thirdly, the GNC also maintains a consultant roster, which has over 300 vetted consultants on it. And we are available to recommend consultant profiles to match specific skill sets and contextual expertise for requests that come our way. Finally, we also offer a webinar support for partners that might require this. We ask requesters to contribute to the cost of the support where they can, but we also have available resources and some grants, particularly for local and national actors. Next slide, please. So colleagues, back to the reason why we're together today. We've come together today and for the next 1 hour at least. We do hope that this consultative webinar will provide an opportunity to all of us to reflect and share some perspectives on locally led cluster transition and deactivation. We are especially hoping to hear from local and national actors, especially from those countries that have either previously undergone transition and deactivation or are currently undergoing or are set to undergo cluster transition and deactivation. This is also an opportunity to brainstorm, and we're also hoping to hear from everyone else and from other partners, whether they are local or international, who are operating in other countries as well. So I'll quickly go through the agenda for today's webinar before I introduce our speakers. We will start with a presentation by 𝗙𝗵𝗃𝗃𝗃, who will give us an overview of the cluster transition and deactivation from the perspective of the humanitarian reset. We will then hear from Dr. 𝗙𝗿𝗃𝗃𝗵 about the experiences of the nutrition cluster transition in Pakistan. Next, we will have an opportunity to reflect and brainstorm and share in breakout group discussions for about 30 minutes. And then we will then come back for about 25 minutes plenary discussion, as well as an opportunity to ask some questions to some of the speakers before we close the event. Next slide, please. I'd like now to introduce our speakers and facilitators before I hand over to 𝗙𝗵𝗃𝗃𝗃𝗃 for his presentation. 𝗙𝗵𝗃𝗃𝗃𝗵 is the localization specialist at the Global Nutrition Cluster Coordination section. We are also joined by Dr. 𝗙𝗿𝗃𝗃𝗃𝗃𝗃𝗃, who currently works as a Pakistan Nutrition Sector Coordinator. We are also joined by our very own Dr. Rasha Al-Adi, who is the GNC's Deputy Global Nutrition Cluster Coordinator. We have two colleagues as well, Cécile, next slide please, 𝗙𝗃𝗃𝗃𝗃𝗃 and 𝗙𝗿𝗃𝗃𝗃𝗃, who will support us with facilitating the breakout group discussions, as well as the French translations during these group discussions. So I'll hand over to 𝗙𝗵𝗃 now. Thank you so much.
Apologies, standing on the already established protocols, and many thanks Qirote for the presentation, and also Stefano for really providing the framework in which looking at the broader aspects on the locally led transition. Please, you can go to the next slide. The context that I'll be sharing is the humanitarian reset and the cluster transition and deactivation, and just providing the broader aspect on the humanitarian reset and also the cluster transition and deactivation. And it's interesting to mention that some of the things that are already in the humanitarian reset were also actions that the GNC had initiated, which they were discussed during the different working groups, including the cluster simplification working group, and now they are in the humanitarian reset work plan. So it's a critical moment, and I would request that the discussion that we are also having here, we are hoping that we will compile the notes and the action points that will be coming from these discussions, and have them also in different platforms and forums. Next slide, please. And for those of us who might not have interacted, Humanitarian Reset is actually an initiative by the UN Emergency Relief Coordinator, 𝗙𝗿𝗃𝗃𝗃𝗃𝗃, which was initiated in March 2025. And it's a strategic overhaul of the global systems, the global humanitarian system, aimed at making, delivering, and financing aid faster, more localized, and more accountable. And it's interesting because the implementation of the humanitarian reset in 2026 is actually also coinciding with the Grand Bargain anniversary. And for the Grand Bargain anniversary, we know that it's been implemented since 2016 to 2026, and this will be the year that we will see the outcomes of the 10 years. So it's they are both different instruments that will be complementing each other. And the tagline is that a humanitarian system that is locally led, globally supported, and rooted in communities and driven by the greatest needs. Next. And some of the progress in terms of the the humanitarian reset since it was established, there has been some notable progress that have been made so far. One of it is with regard to the more direct access to funding to local and national actors through country-based pool funds. Notably to note that country-based pool funds in 2025 was 46.4%. An increase of 11% because in 2024 it was 34.4%, and this is percentage directly to local and national actors. The ambition in the humanitarian reset is to have local and national actors accessing direct 70% direct funding to through the country-based pool funds. Of course, there has been also some few notable progress when it comes to, for instance, the issues around co-leadership and co-coordination, and this is from a broader perspective. So 12% government that co-leading and 7% local and national NGOs. Dr. Rasha, when she comes, she will mention that for GNC, I think we are clocking to almost 90% of clusters, which are more than 90% of clusters which are co-led by local and national authorities at the national level. Yeah. Of course, we've also seen that there has been a 25% reduction on in context, and lastly, we see that clusters were reduced from 15 to 8, and nutrition is among global nutrition cluster is among the 8 clusters that is among those in the 8 clusters that have remained. The last slide, I see Geraldine is coming. Yeah, so just to mention, these are the, sorry, next slide. Yeah, just to mention, these are the key priorities, and we will be happy to share the IAC Humanitarian Reset 2026 roadmap. You can be able to see what are the key activities that we can collectively work together on, and it's broken down into the defend, deliver, and evolve pillars. And I would say this is really a great opportunity for us to also contribute in the shaping of the humanitarian system. The last bit which I will say is that we will be having a broader discussion with the other clusters on locally led humanitarian transition and deactivation, which is the next slide, please, which I would encourage all of us, just next slide. I'll encourage all of us, if you can register for the session. Next slide, sorry. You can register for the session, because the session will have an opportunity to discuss further on how can we strengthen locally led transition. Next slide. Yeah, so this is the session that we will be having. It's going to be on the 5th of March. And this session will be looking at sustaining coordination beyond cluster transition and beyond cluster deactivation. We have the QR code for those of us who would like to register for the session. It's going to be remote. GNC will be also participating. We'll be also having other clusters, and we'll be looking at 2 years down the line. How has transition actions happened in Iraq and Libya, and how can we learn from them, and what are some of the key recommendations? And also the discussions from today will also feed into that session for the 5th of March. Many thanks, and I'll hand it back to the moderator. Thank you.
Thank you for that, Dennis. And as colleagues, just to reemphasize Dennis's last point, that we do hope that some of the key takeaways from today's discussions will help to shape and enrich the session that Dennis will be leading at the Humanitarian Networks and Partnerships Week. So I'll hand over to Dr. Saeed now for his reflections on Pakistan. Welcome, Dr. Saeed.
Okay, a very good afternoon to all of us. And I'm also joined by my colleague 𝗙𝗶𝘀𝗶𝘀𝗵. She will be, taking forward the clustered agenda from now in Pakistan. In Pakistan, the transition for the cluster system is, I think this is the third time that we are looking into this transition for the cluster. A bit of a history. We started with the cluster system in 2005 with a massive earthquake. Rather, the cluster system was introduced in Pakistan, and from nutrition perspective, the cluster started working there with full letter and spirit. It continued on for a year or so. Then it transformed into a working group. And I'll explain a bit that how this working group actually worked. But right from the very beginning, we were in a modality where we were co-leading the cluster. We were not independent. We were co-leading the cluster. And the cluster is national level at the sub-national level. So there is one national level, there are 4 sub-national level, and there are 2 areas. In the 2 areas, we did not have sub-national clusters, but we always had clusters and sub-national clusters in the 4 provincial areas and provinces and a national one. So when we transited for the very first time in 2007 into working groups, at that point in time, we maintained the same co-leadership role at the national level with Ministry of Health Services and at the provincial level with the Department of Health. Why? Because it was not only the coordination, but also the lead in implementation as well, which was from the government side with the Ministry and Department of Health. So 2009 gave us another opportunity to activate clusters because we had a complex emergency situation, an armed conflict in one of our provinces known as KP and the federally administered tribal areas, which actually then gave us really a good platform because in 2010 we had a massive flood where we had to activate not only the cluster at sub-national level in full letter and spirit with all of its component, but we also brought in the sub-national clusters from 4 to 6, whereas we had 2 special areas clusters in Multan and also in 𝗙𝗿𝗶𝘀𝗵, which were covering those areas which were like down the flood stream where there was a lot of losses. So we also did that. But very quickly in 2013, we had to transit again. When we transited, we did not really deactivated the clusters because there was a protracted caseload of the children and mothers with malnutrition, with acute malnutrition. And that protracted caseload was actually identified and it was highlighted through the National Nutrition Surveys and also through all of those evidence generation activities that we had. So we again transformed into working group, but in one of the areas at the sub-national level, we still kept the cluster activated. Why we kept the cluster activated? Because we had complex emergency situation where there was ongoing insurgency and there was armed conflict. So we kept that on. Now, when we transited into the working groups, that actually gave us 2 advantages. One advantage was that our preparation remained at the level where we wanted because of the protracted humanitarian aspects for nutrition in Pakistan. The other thing was our leadership role. Not only us, but the government at the co-leadership role. So the ownership was maintained. If we would have deactivated the cluster fully, not really transformed into working groups, then we would have a chance that we would have lost the ownership. And in Pakistan, the situation is that nutrition is not really housed very well in the Ministry of Health. There are additional charge which are given to either a director or even DG takes an additional charge. So that's something which gave us really an edge. It also really gave us an edge with another issue, and that was maintaining the capacity development initiative. So not only on the coordination, but on the nutrition and emergencies, on IYCFE, and plus a very important one, which is the nutrition information system. Although we went through a number of transitions for the nutrition information system, now we are looking into a DHIS2 nutrition module to be incorporated. But this transition actually to nutrition working groups or at national and provincial level helped us a lot in maintaining not only the ownership but also maintaining the capacity stance that we had. So then we had another major the floods, which actually came up between 2020 2022.
Dayed, sorry, you have 1 minute left.
Yeah, I'll
Thank
wrap
you.
it up. So in
Thank
2022, again, we did not activate the cluster fully, but we worked with the working group, so it helped us well. Now in 2022, we also looked at aspects of localization, and now as we speak of today, OCHA is phasing out in at the subnational level. So localization that we actually initiated will help us, but we do have issues, and I can also relate from my experience from Sudan that localization and particularly shifting coordination to those who are particularly to our NGO partners then has conflicting mandates with UN agency one, also with the governments, because the neutrality that we can bring in as non-implementing partners versus implementing partners of the NGO, that's something which is always troublesome. The other issue is also the independence of the information information flows and information that comes in. So in totality, if I say the transition experience has been sweet and bitter both for us in Pakistan, but the trick is that you do not deactivate, but you actually transform either into a working group. And now, as we are transforming into a sector, rather we transformed into a sector last year, but now it would be a full letter and spirit sector. You keep the ownership, you keep the co-leadership, and at the same point in time, you also keep the necessary capacity which is there, both at the preparedness and at the response level. So this is a bit of our story which we wanted to relate to. And if there are any questions, we would love to answer. Thank you.
Thank you so
Over
much.
to you, Miriam.
Thank you so much, Dr. Said, for those reflections. And we take note of what you've just said, that in Pakistan, the transition experience was both sweet and bitter. And our recommendation will be not to deactivate, but to transform instead and maintain the ownership and the core leadership and the necessary capacity. And I think that, colleagues, gives us a good basis for our breakout group discussions on what locally led cluster transition and deactivation might look like. So we'll spend the next 30 minutes or so in our breakout group discussions. We have language-specific breakout rooms because interpretation is not available in the breakouts. We have two groups. We see that there's about 40 of us on the call today. So we're going to keep it to two groups. The first group is for the English-speaking colleagues. We will have our colleague, Dr. Rasha, in this particular group for any Arabic speakers as well who would like to join and who might need additional interpretation. We have a second group for the French speakers, and this will be co-facilitated by Geraldine and Cecile. So our facilitators will guide the discussions, and they'll share the discussion questions with you once we break out into the groups. However, we ask that each group nominates someone to present their respective groups, someone from their respective groups to do the presentation when we come back to plenary. So let's take the next 30 minutes or so and come back at 3 p.m. East African time at the top of the hour for the plenary discussions. Thank you. So Miriam, maybe I'll hand over to you for any additional instructions.
Yeah, participants are able to join the rooms, which they prefer. If you have any questions about joining the rooms, just please put it in the chat. Either you can join working group breakout room 1 for English and Arabic, and number 2 for French.
Miriam, I'm trying to find the link.
Miriam?
Yes, is this Ruba?
Russia.
Russia. I will put you in the Arabic room, and I will put Ruba in Arabic.
And for the Cecile and Geraldine, there's a question in French. Perhaps you can answer. Raphael Guba has a question on how to join the group.
I've already assigned Raphael to the French room. 𝗙𝗿𝗶𝘀𝗵, can you confirm that you can, some people are joining rooms, other people are unable. Can you see on the screen to join a room?
I don't see anything, Miriam.
Okay, most people have already gone into rooms, so if you can't see the link to join, just type in the chat which group you would like to be in, and I will assign you.
who'd like to you can click on the interpretation. So I think it's still fine. You can debrief in either English or French, as long as the team can go to the interpretation aspect. Thanks.
Okay, good. So I will do it in French. I hope everybody knows how to shift to interpretation. So you need to go at the bottom on the plus button and then click for interpretation, the globe, and choose your language. Donc laissez-moi basculer en français maintenant parce que notre groupe de travail a fait toutes les propositions en français, donc ce sera plus facile plutôt que de la traduction simultanée. Donc on a abordé les deux questions qui étaient posées
Geraldine,
dans
we can't hear you. We can't. Sorry, we can't see you if you put your video on. That's okay. Thanks.
Do you want me to take out my video? Oh, yeah, I don't know
he
why.
asked
That's
you
strange.
to put your video on.
It is on. And I have taken out the little lentils, so something is wrong. Because it's on.
Geraldine, it's okay.
Definitely
If
on.
you're not able, you can still go ahead.
Ouais. Okay, there is something with the interface because okay. Donc, la première question, c'était sur des exemples de transition. Et on a la RDC qui nous a parlé d'un exemple de transition de cluster à secteur au niveau sous-national. Et c'était dans le Kasaï. Ça a été fait l'année dernière. Et ça a été assez intéressant de discuter avec l'équipe sur cette transition parce qu'en fait, ils ont fait quelque chose d'assez graduel. Ils ont d'abord essayé d'identifier les bonnes personnes, les bonnes organisations, et ensuite ils ont fait un plan d'action avec des rôles très clairs entre le co-lead de la partie ONG nationale et le co-lead de la partie gouvernementale. Donc ça, c'est vraiment, ça a été important, cette phase d'identification et de dessin du plan d'action, parce que toutes les activités n'ont pas forcément pu être basculées ou transitées vers cette nouvelle équipe de coordination. Donc il a fallu faire des choix. Et ces choix se sont faits justement dans le temps et à travers de ce plan d'action. Ce plan d'action, en fait, il s'est basé surtout sur le maintien de la coordination et le maintien de tout ce qui est le soutien à la prestation de services. Donc la priorité, ça a été de garder en vie le secteur de la nutrition avec des réunions de coordination régulières et du suivi de l'implémentation des interventions. Tout ce qui était de la partie gestion de l'information, comme c'est une charge de travail assez conséquente, elle a été basculée sur le niveau national en fait. Où là, le gestionnaire de l'information du cluster national, qui lui n'a pas été désactivé, a pris en charge la gestion de l'information. Ça a été une rationalisation qui a été faite pour la RDC. Et évidemment, la clé, ça a été effectivement d'identifier une organisation nationale qui était d'accord pour prendre en charge la coordination et une personne qui a été d'accord pour absorber cette charge de travail qui a été mise qui a été mise en place milieu d'année dernière, je pense. Voilà. On a eu pendant cette discussion une demande assez forte et assez intéressante justement de la part des acteurs nationaux et locaux d'être inclus dans les décisions du cluster parce qu'ils pouvaient être effectivement des aides assez conséquentes, surtout dans ces phases de transition et de transfert des compétences. Donc ça a été bien noté. Est-ce que Denis, do I do question 2 also or I stop in question 1?
Thank you very much, Geraldine, for the input and many thanks for those insights. I'll invite 𝗙𝗿𝗶𝘀𝗵. Also, maybe if you can just summarize to us the discussions from the English and Arabic group. Thank you.
Thank you, Dennis, and thank you, Geraldine, as well, for sharing some of the key recommendations from the French-speaking group. So very quickly, in the interest of time, the English and Arabic-speaking group, quite a number of rich conversation around experiences and good practices, as well as some of the challenges that the colleagues envision in this process. We heard from a colleague from Gaza who mentioned that a lot of meetings are going on and discussions going on around cluster transition and deactivation in Gaza, but they are not seeing a lot of action on the ground. And a recommendation here was to just make sure that a proper transition plan is in place, particularly one that outlines how the people who are affected by crisis will be supported on the ground. There was also some experience sharing from Northeast Nigeria. We had, again, that a lot of discussions have gone on the cluster deactivation process there, but not much action so far. And the cluster continues to coordinate the nutrition response there. So the recommendation here is to learn as much as possible about these processes from any global guidance that is available. We also had from our colleague from Afghanistan who highlighted the importance of strengthening national and local NGO capacity to make sure that they are ready and they're well informed and capacitated to take on this coordination responsibilities. Something else that was highlighted, and I think it was echoed by a number of colleagues, is the importance of resourcing the national and local NGOs to make sure they are able to manage this leadership and coordination roles effectively. We also had a few other recommendations. I think one of the things that came out from a number of colleagues was just the importance of making sure that the leadership is the local and national actors' leadership is not symbolic, as has been seen in coordination structures previously, and making sure that decision-making authorities for national and local NGOs are integrated in the TORs. I think that the question of making sure that that the process of transition or deactivation is gradual was also highlighted. I'll end it here, Dennis, and hand it over back to you.
Many thanks, 𝗙𝗿𝗶𝘀𝗵, for the insights. And again, just to reiterate that transitioning it's happening in Nigeria, Colombia, and Cameroon. So the other context, they are not undergoing transitioning. And this transitioning is transition nutrition cluster from the cluster to the sector. And hence, there still will be some services that will still continue to be offered, even when nutrition will be now, the coordination will be a sector. So the services will still be continuing, and we're not saying that it's now deactivating the cluster to be not functional at all. So it's just moving from cluster to sector. I'll open this up in case there's any pressing questions that would like to ask, and maybe you can ask. Yes, Geraldine?
Sorry, I didn't know we had to debrief question 2 also. So
Sorry,
can I just
we can't hear
debrief
you,
very
Geraldine.
quickly? I don't know. Can you hear me now? Can you hear me?
Yes, go ahead.
Okay. No, I was just asking if I can take 2 minutes to debrief question 2 from the French group, because the first time I only covered the first question. Can I just take 2 minutes of you, please?
Go ahead, Geraldine.
Okay, thank you. So I'm gonna shift back to French. Sorry for
Am I
the
the only one
translator.
who is not hearing from Geraldine?
I don't know, Rasha can hear me? And 𝗙𝗿𝗶𝘀𝗵, can you hear me?
Yeah,
Yes,
we can
hear
you, Geraldine.
Go ahead,
Okay.
Geraldine.
Donc, merci de nous laisser ces deux minutes supplémentaires, parce que dans notre groupe des francophones, on a eu vraiment une discussion très intéressante sur ce processus de transition et comment sauvegarder les fonctions essentielles. Et en fait, le groupe, on était tous d'accord pour dire que toutes les fonctions ne peuvent pas être maintenues. Donc, il faut vraiment faire un bon plan pour identifier les prioritaires, les actions minimales qui vont faire que la nutrition va continuer à survivre et que les bénéficiaires vont continuer à recevoir les services. Et ensuite, intégrer par exemple la gestion de l'information sur les systèmes nationaux, basculer d'autres choses au niveau national ou avoir comment dire, une rationalisation des activités. Donc la première chose, c'est bien identifier les fonctions de base et qui sont importantes pour chaque pays. Ensuite, il faut avoir un plan pour maintenir les ressources. Parce que la coordination, ça coûte cher en termes de ressources humaines, mais en termes de ressources financières. Donc, il faut avoir un plan à long terme pour maintenir les ressources financières, y compris parfois utiliser les fonds multi-années pour maintenir cette coordination. C'est tout un transfert qui doit se faire avec du temps, en dessous d'une année pour transiter et mettre en place le plan, identifier les personnes, les former, tout ça, c'est pas réaliste. Donc c'est quelque chose qu'il faut prendre en compte longtemps à l'avance, au moins une année. Et surtout, très important, cartographier les autres plateformes de coordination qui existent au niveau national, parce qu'elles peuvent être des atouts justement pour maintenir cette coordination une fois qu'on bascule hors de la zone d'urgence et humanitaire. Les rôles doivent être absolument clairs entre qui fait quoi où, et surtout quand il s'agit d'impliquer les gouvernements locaux et des ONG nationales qui vont prêter des ressources et financières et humaines. Donc vraiment des rôles très très clairs, très simples, un plan très concret et une transition qui se fait au moins sur un an. Et surtout ne pas oublier d'inclure les structures locales. On ne pense pas assez, ou en tout cas on n'a pas le temps parfois, de voir quelles structures qui sont lidérées, qui sont gérées par les communautés peuvent nous aider. Les comités locaux, les associations de jeunes, associations de femmes, ça peut être des gens très importants pour nous dans ces processus de transition. Et enfin, évidemment, il y a toute une partie au niveau des intrants qu'il faut faire très attention au moment de transition, de ne pas perdre. C'est-à-dire les intrants qu'on utilise, quels sont-ils? Comment s'assurer qu'ils sont bien utilisés et surtout comment s'assurer qu'ils arrivent auprès de notre bénéficiaire, c'est-à-dire le dernier kilomètre. Donc voilà, c'était des points assez importants qui me paraissaient voilà, qui me paraissaient intéressants de partager avec vous. Qui sont sortis de notre groupe de discussion. Merci beaucoup.
Thank you very much, Geraldine, for the additional insights and reflections. And I would say that from the key points that both Geraldine and 𝗙𝗿𝗶𝘀𝗵 have presented, I cannot add any further. What we're just saying is that there is need for us to explore and strengthen locally led transition and deactivation, and that will be concretized in our next presenter. So I'll be inviting Dr. Rasha to give us I'll be handing over to Dr. Rasha to give us a closing remark and also the perspective of the GNC and the next step in this exercise. Over to you, Dr. Rasha. Thank you.
Thank you so much, Dennis. So colleagues, so while we are getting to the end of this session, I would like first to thank you very much for your attendance. And I would like to re-highlight that in the Global Nutrition Cluster, we continue our commitment to strengthen the localization agenda. Localization is the cornerstone of our new GNC strategy, which we just launched last week. It will cover 2026 to 2029, and localization is really the cornerstone for this new strategy. GNC is really achieved a lot in the previous period in terms of localization. as Stefano highlighted in the beginning of this meeting, that almost all the nutrition clusters or sectors are led or co-led by line ministry, which is the LNAs, part of the local national actors. And also a lot of countries have also engaged more and more national NGOs in the work of the cluster, either as a part of the strategic advisory group or as part of the technical working groups, or also sometimes also acting as co-coordinators or deputy coordinators, especially at subnational level. So we really appreciate all the effort that our national actors are doing, and we will continue our commitment to check every opportunity that we can do to strengthen the capacity of the national actors and help them in many fronts. So please continue to reach out to the Global Nutrition Cluster. You can always reach out to us through the support button in our webpage, in the website, and we will reach out to you. And always please keep the communication with the national coordination team, either cluster or sector. We do not want you to be like afraid or concerned about this, like deactivation or transition and so on. This is general things that because we are speaking also about, we are one part of bigger cluster community, which include also other clusters in many countries. But for nutrition, as Dennis highlighted, we have just 3 countries for transition, which is so far, which is Nigeria, Colombia, and Cameroon. And we are working closely with the team how to move this ahead. And even for the deactivation of the cluster, it is a deactivation and transition from cluster to sector coordination system. So coordination is there. Coordination always saves lives. So thank you, and over to you, Nikorte.
Yes, thank you so much, Rasha. And colleagues, we have now come to the end of our consultative discussions. Time has really flown, and we thank you for taking the time to join us today, despite the technical difficulties, which we apologize for. Thank you also to our speakers and facilitators for taking the time as well. As mentioned earlier, the recording of today's webinar will be available on the GNC website. We'll also be providing the readout from today's discussions. Please look for these resources under the events tab in coming days. We also encourage you to register for the session that Dennis is leading at the Humanitarian Networks and Partnerships Week in a week or so time. I believe, Dennis, you've included the information on the chat, but if not, please do. Colleagues, if you're interested in accessing support from the GNC, such as the in-country technical support or hiring a consultant, these are available to you on the website through NNet or on the GNC. You can use the QR code on the screen to access our support. You can also access this support via the website. You can just have a look and click on the request button on the website that's at the top of the GNC website. And this is available in multiple languages. We also, as mentioned, I think earlier, provide this support in multiple languages. So thank you so much for taking the time, and have a good afternoon or morning, wherever it is that you are in the part of the world. Thank you, and goodbye.
Merci beaucoup.